Now we look at another very important abbreviation in chemical pathology, and this is the aspect of hyperosmolar, non-ketotic, you could say coma. Okay, hyperosmolar non-ketotic coma. Sorry, this bracket is not there. It was this one that was supposed to be in brackets. You understand? It's just a mix up. Okay, so they usually call it what? HONK. You know, some people also call it what? HHS. Hyperosmolar Hyperglycemic State is a complication of type 2 diabetes mellitus. Now I'm about to break it down and give you guys some proper understanding of what it is. So this hyperosmolar non-ketotic coma, you should know that it's more commonly called hyperosmolar hyperglycemic state. Sorry, this is an R2. Sorry, I made some mistakes. I was actually arranging this in the night when I was so sleepy, you know. So it's actually serious complication of type 2 diabetes, you know. So it's characterized by the person having high blood pressure, okay, severe dehydration, and altered consciousness, So you are dehydrated to the level that you are not even thinking well. You understand? So it's a medical emergency, and it's usually caused by the person having type 2 diabetes mellitus that have not been controlled. Maybe the person has not seek medical care, or the person is traditional medicine, or the person has seek medical care but they are not compliant to their drugs. So it gets to this stage. It doesn't just start like that, okay? So it is defined by high blood pressure, more than 30 millimoles per liter, or you could say about, sorry, high blood glucose. Yes, there's high blood pressure, okay? There's also high blood glucose, 30 millimoles per liter, or you could say 540 milligrams per deciliter. Okay, so it's associated with hyperosmolarity. Okay, thickened blood due to your blood is becoming sluggish, it's not moving very well because there's no much water to mix it up. So, it's different from diabetic ketoacidosis, which is a complication of diabetes type 1. Now, in diabetic ketoacidosis, there's a lot of ketones in the body, but for this one, no ketones. Okay, so that's it. So, causes it could be that you have diabetes type 2 and you're living your life normal, but something came in that triggered it to now be going so much, infection, you are missing your treatment, you are having inadequate treatment, you are taking some drugs like steroids or diuretics, so there are side effects, you have stroke, you have heart attack. So the trigger, the potentiate, you understand? So symptoms, you are thirsty so much, and as you are thirsty, you are taking in so much water, you are urinating so much. Being thirsty is what? Polydipsia. Urinating too much is what? Polyuria. Okay, so severe dehydration too, you are confused, you are drowsy, you could go into a coma. All right, so diagnosis is I'll try to check for your glucose levels in your blood and see that it's so high, which is the top criteria for diabetes mellitus. And serum osmolarity is elevated. If I could do ultrasound and see how your blood is moving in your body, it would be so sluggish. Ketones will be absent. Ketones, you only see ketones in diabetic ketoacidosis. The electrolytes often disturbed. So management is this person is dehydrated. That's the emergency. That's what is after the person's life. Try to give them fluid, intravenous fluids. Okay, mix up with not they won't mix up with glucose. The person already has too much glucose. Okay, so insulin therapy. So I'm giving you so much insulin so that this insulin goes into you and breaks down the glucose, right? The electrolyte correction, and for what triggered the emergency to come in, try to tackle it. Okay, and treat the underlying condition. So I think that's what we got for this.